Okay,
Good
very good.
day. We are going to start the third webinar from the cycle of lectures, Introduction to Logotherapy. Rabbi Dr. Shimon Cohen will talk about logotherapy as a supplementary therapy. Have a meaningful time.
Thank you very much. Now, this lecture addresses the idea of logotherapy as a supplementary therapy. As supplementary, as you understand, as an auxiliary, as one which works together with psychotherapy. What is it that it supplements? It supplements and it completes and it guides psychotherapy. So we have the two, logotherapy and psychotherapy. What is the difference between logotherapy and psychotherapy? Logotherapy is about the values, the goals, the meaning, and the purpose which the individual personality seeks to find and express. Psychotherapy, and there are many schools and types of psychotherapy, is the science of healing illness in the physical and mental dimensions of human personality. Logotherapy is about the norm of wellness, how we shall define wellness in psychological terms. Psychotherapy is about the treatment of unwellness in the accomplishment of that norm of wellness which logotherapy has detected. Now, and of course, Frankl said this quite openly. He said that logotherapy is a supplementary theory. It's not there to replace psychotherapies, but it is there to work with them in a specific and a very important way. Now, we shall have more to say about logotherapy's concept of wellness as ethical meaning, conduct, and purpose in coming lectures. There is some ambiguity and conflict and in Frankl's writings about this, and as I've drawn attention in the past, and earlier and later writings in Frankl's work say somewhat different things about the objectivity and universality of values of personality. The strand in Frankl's work, which I am following in these lectures, maintains that there is an objectivity and a universality in values and ideals of personality. This means that the healthy personality is one which incorporates these ethical and normative ideals, and the unhealthy personality displays a divergence from them. In the words of one of Frankl's major students, Elizabeth Lucas, many disturbances in personality derive from not living in harmony with the norms of conscience, the spiritual knowledge and the meaning possessed or discovered by one's higher self. Excuse me. Psychotherapy as a means of treatment of psychological unwellness is a science. Now, while science in general is based on theory, and theories are themselves built on values and assumptions, science in general and psychotherapy as a particular science do not always reflect upon those values and assumptions. Their goal tends to be results. They are practical in character, not the discussion of values. Logotherapy was always ready to acknowledge and utilize the practical efficacy of different psychotherapies. Indeed, Frankl went so far as to say that logotherapy could work with Freudian psychoanalysis, seeming then a strange thing when you think how different and how opposed Freud's overall theory was to that of Frankl. But it could be used, said Frankl, as a practical psychotherapy. That Frankl actually makes a very important point in a footnote. He says that when we look at the Freudian dream theory, you have to understand what part of the personality is dreaming. It's the id, it's not the higher self. So this is so at all events, Frankl says we can and we should use various psychotherapies. Psychotherapy could be used to treat the different levels of human personality, but only as long as it is recognized, but only as long as psychotherapy recognizes the essential spiritual self of the human being as sovereign, and as supplying the purpose for which psychotherapy works. In other words, the goals are to be set by logotherapy, the means are to be supplied by psychotherapy. Whilst logotherapy does not supplant the mental and psychological sciences of personality, it does do two things. A, it helps the patient discover the norms of mental health, which are applicable in his or her own situation. And B, it seeks to utilize the power of the human spirit in conjunction with psychotherapy in the healing process. In dealing explicitly with the realm of values, goals, and meanings, the human existence, logotherapy explains to the human being, patient, in value terms, how he or she is unwell, and seeks to evoke within the patient the will to actualize values in healing, which would constitute the norm of wellness. As mentioned before, it establishes the goals and the will towards the goals for which psychotherapy should supply the means. Thus, logotherapy is supplementary in essence. It provides the goals and the values for the science of psychotherapy, which deal with the means towards it, dealing primarily, as we'll see later, with the somatic and the mental dimensions of personality. That is psychotherapy's principal realm. That realm which is not noetic, that realm which deals with, if you like, elements of the psychophysical organism of personality as distinct from the noetic. Okay, so at the same time, logotherapy, whilst it gives space, very important room for psychotherapy, logotherapy can also, if you like, supervise and discipline psychotherapy, making sure that it does not import values of its own, which are contrary to the idea of the human being as a free, responsible, and moral agent. And I'll have more to say about that later. Okay, so given that this is the basic relationship between psychotherapy and logotherapy, how do we then see how logotherapy and psychotherapy can work together? How do we see it? So it's of great importance to logotherapy to determine the level of personality at which a particular psychological problem presents or manifests itself. This is, I'm sure many of you are aware. You know Frankl's famous example of the circle which could be either a disc or it could be the base of a cone. In other words, the same shape can in fact pertain to quite different things altogether. Okay, so first of all, you have to answer first. Frankl, of course, developed this very important concept of what he calls a dimensional ontology of personality. In other words, a sense and a clear demarcation of the different levels of personality, whether they are somatic, whether they are mental, or whether they are noetic. Now, so first thing that logotherapy does when it wants to work together with psychotherapy is to locate the level of personality at which this particular problem is presenting. Now, of course, as pointed out, psychological problems can stem from a variety of levels of personality. There could be a biological, a neurotic, and all different factors can play together. Still, in general terms, Frankl seeks to determine the level of personality at which the problem is presenting. Now, and one of the reasons why we have to locate the level in human personality at which this problem exists is because the power of the free and responsible human spirit, which is the subject of logotherapy, this varies according to the different levels of personality. These levels of personality, as noted earlier, are first of all the bodily, emotional, or alternatively, you could also call it physiological or somatic or biological level of personality. Secondly, there is the mental or psychological level of personality, which is concerned with perception and control. Thirdly, there is the meaning or the noetic level of personality, which is concerned with the meaning and the values which orient personality as a whole. Now, it is possible for what looks like the same illness to be quite different depending on the level of personality at which it is manifested. Frankl gives as an example depression. Depression can have a biological or hormonal, a clinical expression at the bodily or physiological level of personality. It could be, for example, that postpartum or postnatal depression could be an example of this, which has important hormonal considerations. There are other forms of clinical depression which have a strong biological foundation. But depression can also exist at another level. It can be associated with anxiety and perception at the mental level. Finally, depression can have an existential expression. It can manifest as a spiritual or intellectual despair, a sense of meaningless, or an existential void. So psychological illnesses manifesting primarily on one level of personality can have causes which originate also in other levels of personality, as we've mentioned. It's not that everything fits on at one level necessarily, but in generally speaking, however, as mentioned before, we associate psychosis with a basis in the physical or bodily level of personality. We associate neurosis with the mental or perceptual level of personality. And we associate psychological problems associated with spiritual or existential discontent with the highest or the meaning or noetic faculty of personality. So the identification of the level of the psychological disorder is important. Different psychotherapies are used depending on the level of the disorder. For example, the treatment of schizophrenia will often include chemical and drug treatments because schizophrenia has a significant physiological and biological basis. The treatment of trauma, on the other hand, will involve talking therapies, perhaps also with some medication, because it belongs with the class of neuroses manifesting mainly at the mental level. Psychological illnesses, which come from a crisis in meaning, on the other hand, do not require chemical sedation because they relate to a spiritual crisis or a crisis of meaning. One does not and one should not treat a crisis of meaning with pills, with tranquilizers. It's completely inappropriate. At each of these three levels of personality, with their associated illnesses, we also find a different role for logotherapy. The level at which logotherapy has the least foothold, which means logotherapy is most tenuous, is most limited, is in psychological illnesses which have a physiological or somatic basis. As an example of this is schizophrenia and other psychotic illnesses. The schizophrenic experiences himself or herself through the perception and actions of others. He or she becomes an object, being watched. He hears voices which reach him. He has little sense of himself as a centered, thinking, free subject. As an object in his own eyes, he is depersonalized. This breakage in the very ability of the schizophrenic to understand him or herself as a free, choosing, and deciding subject makes it very hard for him or her to hear himself, his own inner being. As little as he relates rationally to others, similarly does he very little relate to himself, his own inner moral and spiritual self. Now, so what can logotherapy do with the schizophrenic? It's not the schizophrenic has a deficit in rational understanding itself. So what can logotherapy attempt to do with the schizophrenic is to locate that fragment of one's own healthy, essential spiritual self and embrace this residue of freedom which grants the person, and to find that, if you like, that healthy spiritual self, that element of that spiritual self within, which gives him freedom, which gives the person a little bit of freedom in relationship to his own circumstances, including his own illness. It is possible to find, and the schizophrenic sometimes by him or herself finds this residue, this remnant of the healthy, moral, deciding self. Now I think I may have told this story last time, but I'll tell it again. That Frankl tells the story of how even without a therapeutic intervention, schizophrenic and delusional individuals may gain sudden access to their inner intact essences. They can perceive that they are unwell, radically distinguishing themselves from their delusional state. So here's the story which I told once. So please excuse me if I repeat it here. So this story relates to two identical twin sisters, both of whom were schizophrenic and were living in the same psychiatric institution. One day, their treating doctors, psychiatrists, mixed up the patients, the identical twin sisters. So they were treating. Each one had gone to the wrong therapist, the therapist of her sister. One therapist began a session with the sister, who was not his patient. He began with a resume of her delusional experiences from the previous session. In fact, of course, these were in fact the experiences of a sister, not hers, the report. She at once interrupted the therapist, saying, "Doctor, you've mixed me up with my sister. I have a much better story than that." So there was a moment of humor. She could see. She could see that. She said, "I have a better story. My delusions, those delusions are not my delusions." In other words, in a moment, her healthy self could emerge and saw that she was sick. That was only because of something within her which was healthy, which could actually distance itself from the sick part of her personality. So humor is a method of logotherapy whereby the patient, so to speak, laughs or distances itself from the delusional self. And through this humor, I mean, there are other means as well, of course, various kinds, paradoxical intention and the whole series of other means. The schizophrenic woman was able to transcend and distance herself from her own illness. So that is in cases of schizophrenia, as mentioned, logotherapy has most difficulty. But even there, the task of the logotherapist will be to look for and to detect that residue of freedom, that element of the intact spiritual self, which is still sovereign within the person. And there was another story I think I may have mentioned earlier about an experience in the concentration camp where a girl who had suffered the most terrible abuse from the guards in the concentration camp and was able to muster and was able to achieve a moment of spiritual clarity in which she actually prayed with Franco, and which she emerged, so to speak, out of her delusional state for those moments. Now let's look at an example of an illness which manifests itself primarily on the mental level of personality, neurotic level, say like neurosis, and how logotherapy works there. An example of such an illness is an obsessional neurosis, such as fanatical cleanliness. A person who is obsessive, compulsive, hand washing, or something of that sort. Now, this, like many neuroses, may have a hereditary or biological cause as well. But, says Frankl, this becomes a neurosis as a result of a mental decision on the part of the patient to allow this predisposition to develop into a full-blown obsession. Unlike the schizophrenic, the neurotic can think, can decide, and can hear his or her higher self. Here, the logotherapist's task is to transform the neurotic's attitude towards his neurosis. The neurotic needs to be brought by logotherapy to the recognition of his neurosis as a possible but badly chosen state of being. In other words, as the result of a decision which he or she can reverse. Now, of course, all of this is going on. I'm not mentioning the various different kinds of psychotherapies which can be brought into play here, but at all events, this is what I am talking about is the role that logotherapy will be utilizing here. Now, that reversal may be assisted through psychotherapeutic techniques, but logotherapy can give the patient the insight into and the will towards this goal in his or her healing. So we've dealt with, so briefly, psychotic illnesses, which in relation to the somatic level of personality, neurotic illnesses, which relate, if you like, to the mental development of personality. But it's in the highest, the meaning or the noetic realm of personality, where psychological issues are a result of a failure to discover meaning, that logotherapy has the greatest power. In other words, in the area of, let's say, existential or spiritual crisis. This is where logotherapy comes into its own most strongly. Now, and it's very important also, as I mentioned before, to realize, to make sure that one does not associate the noetic dimension with a concept of something which is in itself healthy. The noetic function itself can become disordered. And Frankl spoke about, for example, various kinds of collective pathologies of the times, of value sets, which are forms of disordered noetic consciousness as well. At all events, here in this realm, in this noetic dimension, logotherapy can prompt the individual to self-transcendence, to analysis of the possibilities of his or her own existence, and can open up an entire new realm of meaning, which brings the person into a state of mental well-being, psychological well-being. Thus, Frankl observed that psychotherapists very often in this area were increasingly taking over the role of the religious mentor or minister. In other words, Frankl writes that people with ordinary existential crises are going to psychotherapists, and this is a problem. It was an error, because it was not a psychotherapeutic response to an existential crisis could very often be highly inappropriate. When their real issue is an issue of meaning. Accordingly, logotherapy here understands that such a psychological crisis of patients like these is essentially an existential crisis, a crisis of meaning, and the appropriate response is not psychotherapeutic, but so much as finding logotherapeutically ways to stimulate the quest for and the discovery of meaning in the patient. Now, I want to deal now with the issue of the dangers of a psychotherapy without logotherapy. We show how they work together, and but now we need to actually to address the problems which arise when psychotherapy is applied without logotherapy. Logotherapy has an affinity with philosophy and practices this in what's called existential analysis, or analysis of existence. And as has come up in previous lectures, people are tempted when we see the expression existential analysis, people think of existentialism. Well, Frankl's work is very different from the existentialism of a Sartre or a Camus or a Heidegger, and so on and so on, or a Kierkegaard. Maybe Kierkegaard I'm not so sure about, but at all events, it is very different, because Frankl, the concept of existential analysis is concerned with the affirmation of meaning and the discovery of meaning, whereas existentialism actually repudiates the concept of essential meanings and maintains that the human being's act of freedom consists in not being bound and not binding him or herself to any transcendent values at all. So it's very different altogether. At all events, logotherapy in its analysis of existence is what it does is to take life situations, the situations of the patient, and to look at them in terms of their opportunities and challenges for meaningful response. It's about the elicitation of genuine meaning. Genuine meaning has to do with values, not like as in existentialism, with the overthrow of values, with the repudiation of essential values or principles. As we'll discuss in coming lectures, we come up here against the inevitable question as to whether there are objective and universal meanings. And if so, what role objective and universal values play in therapeutic practice? This raises problems from the standpoint of value neutrality, which has been presented as an ethical requirement of psychological treatment. Now, why should one posit value neutrality? Why should one refrain from ethical judgments as a requirement of psychology? One answer which is given is that we don't know what is right and what is wrong, what is a wrong norm of human behavior. In other words, that is in other words, because who are we to posit concepts of right and wrong anyway? This was not the view of Frankl. Certainly in many of his writings, Frankl was not a moral relativist, and he believed in universal values. Now so there is, and there so it cannot be that the value concept of value neutrality cannot be based on moral relativism. But there is another reason for the therapist not to state values openly. And this is because there's not necessarily any benefit in preaching values to the patient, even if these are true values and the values which the patient needs to know. The reason for this is because meaning and values are effective and resonant only when the patient comes to them by him or herself. Frankl indeed sought to lead patients in their own discovery of what are universal values. So very important. It becomes therapeutically efficacious when the patient comes to it on his or her own. The problem is not when psychology discusses values, as does logotherapy discuss. Logotherapy does discuss values. The great problem arises when psychology does not discuss values. That's the main, and does not reflect on the values which it implicitly expresses, on which it is hiddenly based. Many therapies are based on value assumptions which are not examined, and these value assumptions are very major, significant, and can sometimes be quite harmful because they represent a model of the human being which may indeed be a false model of human personality. For these values, for example, the unexamined values of certain psychotherapies can in fact be harmful, opening up the problem of iatrogenic or medically or psychologically caused illness. That is to say, where psychological theories and practices themselves become a source of harm. And Frankl spoke about this in the case of Freudianism. And we'll see about this also later in certain contemporary phenomena, contemporary psychological theories. So Frankl, as I mentioned, yes, he discussed the ideological impact of Freudianism in the mid-20th century. The essence of Freudian psychoanalysis as a cultural and ideological movement was that it eliminated human moral responsibility. Its tendency to find the basis of all mental health and ill health in instinctual release and inhibition, in fact, closed down the freely choosing and deciding meaning faculty of the human being. So he perceived Freud, even though we've said before that Freudian theory can be used in conjunction with logotherapy, but Freudian theory on its own was not necessarily a beneficial therapy. In fact, it worked against human responsibility. Now, as with Freudianism, we have exactly the same problem, and perhaps even more so today. I'm sorry, here I'm going to be a little controversial, but I feel it's necessary to do so. A world trend in psychology was initiated already in 1973, when a political struggle took place in the annual meeting of the American Psychiatric Association. And this led to the deletion of homosexuality as a psychological disturbance, instead redefining it as a species of normal sexuality. This was followed also, and it's one of the proponents of the so-called deletion of homosexuality from the diagnostic manual. This person, Robert Spitzer, he wanted to maintain a concept of ego-dystonic homosexuality. In other words, a situation in which a person had homosexual impulses, but was disturbed by it, was unhappy with it. That he called ego-dystonic homosexuality. In other words, the idea that a human being could legitimately be disturbed by his or her own homosexual tendencies and legitimately request therapy to overcome them. That was also ruled out. That even the concept of ego-dystonic homosexuality, that a person could be unhappy with their homosexual self with the same-sex attraction, that was also eliminated as a mental disorder, which was worthy of treatment. Then that led in turn to the affirmation of gender fluidity in psychology, which in the West has been implemented in child education and psychological practice with drastic consequences. There is presently, the case there was a class action brought by 1,000 individuals against a Tavistock clinic in Britain, which has now been closed down, which transitioned children to alter their bodies through sexual surgery, causing them subsequent major psychological trauma. So here is a case where therapies are in practice which incorporate value assumptions, which are not subject to proper philosophical critique, or which are philosophically highly contentious. And certainly, in my opinion, Frankel's logotherapy would expose the ideological foundations of such therapies, which actually become a source of harm. This ideology in mainstream Western psychology has become a source of mass psychological harm. And it is because it is dispensed with logotherapy and the reflection on values, including the rejection of the concept of universal values and norms of human personality, and the concept of human freedom and responsibility. So here we see with our own eyes the harm that can be caused by psychotherapy without logotherapy.